Chocolate for fat loss sounds fake. But what if the problem was never cocoa? What if the problem was how cocoa was changed? Dr. Michael Greger, who analyzes nutrition studies from PubMed and major health databases, has repeatedly explained that cocoa is not just a flavor, it's a biologically active plant compound. In this video, we'll break down what cocoa actually does inside the body, what major health organizations say, and why pure cocoa behaves very differently from chocolate. Watch till the end, because one detail decides whether cocoa supports fat loss or silently works against it. So let's start the video. Don't forget to subscribe our channel. Cocoa is a plant, not a dessert. Dr. Greger explains that cocoa starts as a whole plant food rich in flavanols, especially epicatechin. These flavanols are powerful antioxidants studied for their effects on blood flow, insulin sensitivity, and metabolism. The American Heart Association recognizes cocoa flavanols for supporting vascular health and circulation, which directly affects metabolic efficiency. This immediately separates cocoa from candy. One supports physiology. The other overloads it. Dr. Greger's core message: fat loss is metabolic. Dr. Michael Greger emphasizes that fat loss does not begin with burning fat, it begins with fixing metabolism. According to studies he reviews, cocoa flavanols improve insulin sensitivity, allowing glucose to enter cells more efficiently. When insulin works properly, the body is less likely to store fat and more likely to access it. Cocoa doesn't force fat loss. It removes metabolic resistance to fat loss. What NCBI and PubMed studies show. Multiple human studies indexed in NCBI and PubMed report that cocoa flavanols reduce oxidative stress, improve nitric oxide production, enhance metabolic flexibility. Nitric oxide improves blood flow and oxygen delivery. Better oxygen delivery means mitochondria work more efficiently. And efficient mitochondria are essential for fat oxidation. Dr. Norman Hollenberg, Harvard Cocoa Research. Dr. Norman Hollenberg from Harvard Medical School conducted some of the earliest controlled research on cocoa flavanols. His work showed that populations consuming high flavanol cocoa had better blood pressure regulation and healthier vascular function. Dr. Hollenberg demonstrated that these effects were not caused by sugar or fat, but by cocoa's natural flavanols. His research helped establish cocoa as a functional metabolic food, not a recreational treat. WHO and Global Health Perspective. The World Health Organization emphasizes reducing ultra-processed foods and increasing intake of polyphenol-rich plant sources. Cocoa, in its pure form, fits this definition. WHO-linked research shows that plant polyphenol play a role in preventing metabolic disorders linked to obesity and insulin resistance. This places cocoa within a preventive health framework, not a weight loss gimmick. Appetite, cravings and gut health. Dr. Greger also highlights how cocoa flavanols interact with gut bacteria. These compounds act as prebiotics, supporting beneficial microbes linked to healthier body weight. Human studies show cocoa intake can increase satiety and reduce cravings for high-sugar foods. This indirectly supports calorie control without suppressing hunger artificially. The biggest cocoa mistake. Dr. Greger warns that most people consume cocoa in the worst possible way. Milk chocolate removes flavanols. Sugar spikes insulin. Dairy blocks flavanol absorption. Research shows that adding milk can significantly reduce cocoa's biological benefits. This is why many people say cocoa doesn't work. They never consumed cocoa. They consumed processed chocolate. What form actually matches the studies? The cocoa used in research is unsweetened, minimally processed, high in flavanols, free from added sugar and dairy, consumed in small, consistent amounts. This is the form Dr. Greger refers to when discussing cocoa's health effects. Dr. Michael Greger's analysis, supported by Harvard Research, NCBI studies, the American Heart Association, and WHO guidelines, leads to one clear conclusion. Cocoa is not a fat loss shortcut. It is a metabolic support tool. When misunderstood, it blocks progress. When used correctly, it supports the conditions fat loss depends on.